This program is made possible by the New York law firm of Zalman and Storman, who specialize in the field of personal injury law. Welcome to Lawline with your host, Alan Schnorman. Mr. Schnorman is a distinguished trial attorney, author, and lecturer. Each week, Lawline will bring you the most knowledgeable experts in the field of law today. And now we introduce our guest and our host, Alan Schnorman.
Welcome to Lawline. Under the current law, a person's AIDS or HIV status is confidential and cannot be disclosed without the express permission of that individual. Today we'll see if there are any circumstances which that information can be disclosed and find out what rights a person with AIDS or HIV virus has under the existing law. Our guests are Evan Wolfson, an attorney with Lambda Legal Defense and Education Fund, and Dr. Jeffrey Kaplan, an orthopedic surgeon who feels treating doctors should have this information, have a right to it. Hello, Evan. Hello, Dr. Kaplan.
Hi.
Hi. Evan, what is the existing law? Does a doctor have the right to know if the patient which is treating, the patient which is going under his knife in the surgery, has AIDS or not?
Right. No. The patient has no duty to disclose HIV status or AIDS, or for that matter, any other medical condition. The same rule applies for HIV and AIDS as applies for any medical condition. Patients have no obligation to disclose this information to doctors because doctors don't need to know it, at least not so far as the doctor's protection of himself, herself, or the staff.
Okay.
There are reasons why a patient would want to disclose it in the interest of medical care, but in terms of affecting what the doctor ought to be doing, it's not something the patient needs to disclose or should have to disclose.
Now, Dr. Kaplan, I know you're opposed to that position. Why is that?
Well, I think the position is an interesting platitude, and it's very simple for someone who is not there with their hands in the wounds to say that the patient does not necessarily have to disclose his HIV status or her HIV status to the physician taking care of this individual. Physicians, especially in high-risk specialties, such as orthopedic surgery, general surgery, very high-risk specialties, nurses who deal with renal transplantation, organ transplantation, renal dialysis, all of these people have a very high risk of possible infection. Doctors and surgeons in general will have a needle puncture, at least of one sort, 40 times a year. The chances of picking up an HIV infection, becoming infected from that needle stick, is at least 1 in 240. Over a period of 4 or 5 years, your chances of becoming infected with AIDS is extremely high. And in addition, the statistics can be manipulated in any way. Those of us who deal with this on a daily basis, especially people who are in very, very high-risk areas, where a significant number of people who hit that emergency room, multiple trauma, or in areas where there's a very high prevalence of HIV positivity, have to be aware of what's going on, because universal precautions aside.
Well, Dr. Wing, how many people do you operate on in a day?
The numbers vary, but I would say that each individual in an active practice would operate on at least 250, maybe somewhere up to 400 or 500 people a year.
I could appreciate that, but I'm interested in you. Have you ever stuck yourself with a needle?
Yes.
And how often does this come? How often does it happen to you?
Well, when I read the statistics of 40 needle sticks a year, I think that could be an underestimate in a very high-risk specialty, because we're dealing with major trauma, multiple trauma, lots of blood.
When you say lots of blood, you're an orthopedic surgeon. What is lots of blood?
We do cases which range from very, very small amounts of blood being lost for minor elective cases to very major amounts of blood being lost. We're on emergency trauma call at several hospitals. I belong to a 4-man orthopedic practice. We have a huge emergency trauma call, and we're constantly in blood.
Evan, what do you think about what the doctor said?
Well, first of all, let me start. The doctor began by saying it's easy for people who don't have their hands in the wounds to talk. This is not a position that I'm putting forward. This is the position of the American Medical Association, virtually every surgeon's association in the country, the American Public Health Association, the Orthopedic Surgeons Association. Every reputable medical association in this country has taken the position that in order to protect themselves, doctors don't need to be trying to find out what is the HIV status or any other condition of the patient. They need to be doing what the doctor dismissed, which is universal precautions. Universal precautions, which is also mandated by the government, means that a doctor has to assume that every patient that's coming in might have HIV or some other infectious condition and has to protect him or herself accordingly. That means using the right equipment, taking the amount of time necessary, using the right care, the right procedures, and in some cases altering procedures in order to make sure if they feel they can't do something a certain way, do it a different way, because you cannot know who has HIV and who doesn't,
Evan,
whether or not the patient
are there any
tells you.
communicable diseases that the doctor should know about that the patient which he's operating on has?
Well, the fact of the matter is, the blood, and the doctor can correct me if I get the exact number wrong, the blood alone can contain up to something like 27 infectious conditions, HIV being one of them. Another more common one, and a one that has actually caused more deaths and injuries to doctors and healthcare workers, is hepatitis B. You cannot tell from looking at a patient whether a patient has these or any other condition.
Well, that's pretty terrific, except there is no immunization for HIV. There is immunization, which all of the surgeons are getting for hepatitis B.
All of the doctors may be getting it, but the fact of the matter is every year in this country we have far more healthcare workers who contract and who in fact die from hepatitis B than HIV.
Well, HIV is a disease that is universally lethal.
I understand
you will
that,
die
but
from
tell
HIV.
that, but the fact of the matter is more healthcare workers
have you spent
die.
1 minute in an operating room on the other side?
No, but the American Medical Association has.
Well, first of all, your blanket statement is completely wrong. They completely insist that everybody should practice universal precautions on every single patient.
And the government requires
that.
Isn't that right?
It's very simple as to why.
The government
because
requires
because there is an agenda by certain segments of the population who feel that because HIV is such an extremely strong political problem that it's come so full circle that instead of protecting people in the healthcare field and also protecting patients who are going to be exposed, because doctors are not only renderers of medical care,
in fact,
they're also patients.
In fact, the studies that have been done by these groups make it very clear that the best way to protect healthcare workers and to protect patients is not to do what you're doing, which is try to pick and choose which ones do and which ones don't.
That's not exactly.
The way to do
that's not what I'm saying.
Everyone.
That's not what I'm saying.
Well, what are you saying?
I'll tell you. Well, obviously you don't understand. You're not listening.
Doctor, let me ask you this. Have you found from your friends, I know you're talking on a practical level, you're talking about a day-to-day level, are you finding that your friends are moving out of urban areas into other areas where maybe HIV or AIDS is not as prevalent as it here is in metropolitan New York, New Jersey?
You are an intelligent parent. You have a child who's going to be going to medical school. You're going to say to your child who said, you know, I want to take a residency program at Kings County Hospital, or a residency program at St. Vincent's Hospital, or a residency program at Boston City. And you're going to say, you know, or at San Francisco General. And you're going to say to your child, you're going into an environment where your exposure is very, very high to HIV. Is that what you want to do? And you're going to think about it.
So what he's saying is doctors ought to be free to discriminate and ought to go to places where they don't have to treat people with HIV.
Well, now you're saying what doctors should do.
No, I'm saying what you're saying.
I will tell you that if cancer of any sort were a communicable disease, if you can stick your finger with a needle of someone who has ovarian cancer and thereby get ovarian cancer, there would be a whole to-do about how we need to protect people from that sort of
Evan, let me ask you this.
And I agree in universal precautions, completely, absolutely.
Well, then,
okay, Evan,
wait,
I
believe. Let's just do it one step at a time, so maybe we can actually try to see if we maybe can agree on something. Okay, you said you agree with universal precautions. Okay, just so everyone understands, universal precautions means that with every single patient, Doctors need to do what needs to be done to protect themselves. No, let me just finish. To protect themselves against infection.
You know what that is?
Do we agree on just? Do
Doctor,
we agree
I
on
know
that definition?
you brought with
To
you, I see.
reduce your risk of getting an infection.
No,
I
to
compl-
protect yourself against
All
To
right,
infection.
reduce
one
your
second.
risk. To protect
Gentlemen,
yourself
gentlemen, please.
indicates that maybe it's
Gentlemen.
going to prevent. It's not going to prevent.
It
Doctor,
does, but it does in fact prevent.
Evan,
100% of the time?
Doctor, the number of
Is that an
doctors,
answer?
the number of doctors.
I say 100% of the time, and you say doctor.
Are you saying
That's
that
not
medicine?
an
Are you
answer.
saying
All
that
right,
medicine?
gentlemen, shh, please, down. Let's calm
I
down one
live
second.
this
I mean-
every day. Everyone I deal with lives this every day.
Yes, Doctor.
And
that's
I
right.
will tell
and so
you.
does the AMA, and so do all the other medical
The
associations,
AMA,
and so does the government
does not
that adopted the
represent
standards.
every doctor who
No, it doesn't
sits
represent
and
every
works every
discriminating
day.
All right,
doctor.
gentlemen,
It
please.
has nothing to do
Gentlemen.
with discriminating. It has to
Gentlemen,
do
please.
with how a doctor needs to know and his staff needs to know
Doctor,
what
when
you're
when a
dealing
patient
with.
comes into you, can you tell if that patient has HIV? Yes
You
or no?
absolutely cannot tell.
Okay, so isn't your best way to protect yourself as a doctor to assume that that patient has HIV and take the
Evan, let me
precautions
ask you
You
this.
don't understand
Gentlemen,
at all,
please.
Mr. Wolfson, the
Is-
fact
what's
that...
the answer to that?
Let me explain to you what the answer is.
Let me ask it again, so because I think it's a
I'm
simple
explaining it
question.
to you.
Okay, the patient, you can't tell
You
if this
keep,
patient.
you keep asserting that there's going to be some discrimination carried out against this
Don't
individual.
change the subject.
Wait,
You seem
gentlemen,
to be
please,
asserting that,
gentlemen,
but you're
please.
asserting the wrong thing.
I'm asking
that
you
is
this
not
question.
the assertion that should be
You
made.
can't tell if this patient has HIV, right? Any patient that comes in.
No, I can
if
tell
he-
that certain patients
Evan,
have
can a
HIV.
doctor
very high
refuse
risk.
to treat
But
a
I'm going to get a
patient?
history in this
Evan.
patient. I'm going to find out if this patient is an
Evan.
intravenous drug user, if this patient is a gay or bisexual, if this patient has
Doctor, what does the
hemophilia.
CDC, what does the Centers for Disease Control, the federal agency,
I'm
say?
getting a history on my patient.
It's like-
Am I
can I
permitted
ask
to
you
do
the-
that?
well,
Should I do it?
can I ask you the question?
Should I get the history on
Sure,
the patient?
you can get a history. Now
And
let me ask
what's
you
the
the question.
purpose of the history?
Now let me ask you the question.
I'm asking you what the purpose of the history is.
What does the Centers for Disease Control say that doctors should do in using a history to decide on using universal precautions?
Everybody should have universal precautions.
Exactly right.
And I completely
Everybody
agree
should have
with that.
universal
And I
precautions,
completely agree
which,
with that.
which means that every patient has to be treated as if he or she has AIDS.
That has
Evan,
nothing to
yes,
do
and
with
Dr.
knowledge.
Evan,
Yes,
one second.
everybody should.
Okay,
Doctor,
well,
You're
one second,
absolutely
Doctor,
correct.
and
please.
if you're treating everybody as if they have HIV, then you're treating everybody as if they have HIV.
We're going to go to a
That
break
is exactly
now.
not the
Certainly, I'm
reality.
going to ask questions right after the break. You're watching Lawline. Stay with us.
After dating the guy forever, you think I could tell him anything.
Why is this so hard? I'm really scared.
It takes a lot of guts to tell someone he's too drunk to drive. But you can do it. Just say it. Because if you don't, there may be nothing left to say.
Kevin, I'm gonna drive.
Take the keys, call a cab, take a stand. Friends don't let friends drive drunk.
When your employees train with the National Guard and Reserve, they learn to be better team players, better decision makers, and better leaders. It's training that makes them better at serving our country. And better when they come back to work for you.
Bill's back.
Be a hero. Give your employees the freedom to protect ours.
Hello, I'm Alan Schnorman. You're watching Lawline. I'm your host. Today's topic is AIDS and whether or not a doctor is entitled to know whether or not his patient he's treating has AIDS or HIV positive. With us is Dr. Jeffrey Kaplan. Dr. Kaplan is an orthopedic surgeon and basically has his hands, as he's described it, in blood almost every single day.
Well, he has his hands, hopefully, in gloves in blood.
And, of course, we have with us Evan Wilson, an attorney with the Lambda Legal Defense and Education Fund. Evan, can a doctor, if he knows a patient has AIDS, can he say, I'm not going to treat you, go somewhere else?
Can the doctor do that? Yes.
No, legally permissible.
Legally, the doctor
And
is not
ethically.
allowed to do it. And ethically, and this goes to what the doctor was saying before, ethically it's unethical for a doctor to refuse to treat a patient for that reason, AIDS or any other condition.
Okay.
And in fact, when the doctor was talking earlier about students trying to get out of their obligations to treat everyone by trying to pick and choose where they can go, that's unethical. That behavior has been condemned by virtually every medical association, by medical schools, and so on. And for the doctor to rely on the fact that students are trying to evade their obligations to care for the public, instead of sending the right message, which is, listen, folks, we have a problem here, we all have it, we all have to work on it together, and we have to treat it universally.
Well, I think what
it's really a terrible thing.
What the doctor said before the break was that students are trying to select areas that where
understand.
AIDS patients
Right, and
aren't
that's
as
the-
prevalent as in New York metropolitan, which has one of the highest AIDS patients in the United
And those
States.
students are making a terrible mistake because they are thinking that somehow they can avoid or reduce the need to protect themselves by going somewhere else.
You
and
keep
the fact of the
saying
matter
that,
is,
Mr. Wolfson. That's
HIV
exactly
is here
wrong.
throughout the country.
You keep saying avoid the need to protect themselves, and I have said many times, and let it be clear, universal precautions at all times. However, you're not living with a reality. You're living in a platitude. You have an agenda. You have a reason for
To the
saying the things you're
universal-
saying.
What kind
Doctor.
of discussions is? It's not my agenda. This
Of course
is the
it
government.
is. Of course it's your
Government.
agenda.
Well,
no,
it's the
no, no,
AMAs
no, it isn't.
too.
No, no, no.
Oh.
You see, the government has been moved in certain action as a consequence of political
Oh, I see. And
realities.
the AMA?
You don't think so?
And the
Let's-
AMA?
Yes, even
And
the
the
AMA
American
is
Public
very
Health
political.
Association?
What have they
One
said
person talking
that
at
you're
a time.
disagreeing with, that I'm disagreeing with? I believe that universal precaution should be universal.
Doctor.
Every single person.
Doctor. They make
That's
them
not
universal.
what,
Second.
that has nothing to do
Dr.
with a doctor
Kaplan, let
knowing
me ask you this.
a doctor or a patient knowing somebody's HIV status. If you're going to treat that patient, that's important information.
Doctor, do these precautions on a practical level, on an everyday level, are they working? Do you feel safe?
No, you don't feel safe.
Okay. Now I see you brought with you certain
Are
of
you
the
still
universal
practicing, Doctor?
precautions with you. Can you show it to the
I'm sorry, what's
to
your
the
question?
audience?
Are you still practicing medicine?
Why do you ask the question?
Is that
He's
a yes?
practicing every day. Can you show
Mr.
us?
Schnorman just finished telling you I'm an active practice in
Right.
orthopedics.
Okay,
I
so
just
you
finished
are
telling you
still
I do
practicing.
500 operations.
Okay.
What is your question?
All right,
Still
gentlemen,
practicing.
please. This is
Do-
not.
do you-
Mr. Wolfson, what is your question?
Do you try to find out whether patients have HIV or not?
Of course I do.
Okay, do you
Of
do
course
that?
I would like to know that
If a patient comes
information.
to you and says,
Yes.
I don't know, or I don't want to
Why
tell
don't you ask me if I've operated on HIV
Well, wait, let
positive
me ask you
patients?
this question.
Well, why don't you ask me that question?
Because I'm asking you
Well,
this
I'll
question.
give you the answer because you have some other reason to ask me. I operate on HIV patients. I treat HIV positive
also
patients.
operate on
I treat
patients-
patients with AIDS.
And you-
I want to know who they are, and I'll tell you why. The realities of an active practice mean that although you are taking universal precautions, there are moments in your life when you want to be incredibly careful. And it's the incredibly
so you
careful
wanna change the
that
precautions.
No, not at all. But I am telling you
You don't want to
that
change the precautions.
the reality is that everybody practices universal precautions. There are, and should,
Yeah.
there are times when you, in your daily life, you have to go a little slower, a little more carefully. That a little more carefully. You can't spend your entire life thinking a little more carefully. But I will tell you the reality is when you're there and you know the patient is HIV positive, you are that little more careful. And that's important. That's going to
what
save
about when
me
you
from a
don't
needle
know?
stick.
What about when you don't know?
You're still careful, but
Okay.
if you know, you're a little more careful.
it is
And if
true.
you don't understand that as human nature, then you don't
Doctor,
understand
let
human
me ask you
nature.
It is true, doctor, that you have treated patients who probably do have HIV, but you don't know.
Correct.
Isn't that right? Okay.
Correct.
So again, when there's a patient in front of you,
Correct.
this patient may
I practice
have HIV.
universal precautions.
Right, because
but
you
I will
have
tell you
to-
something else. When I know a patient's HIV status, and I know the patient is HIV positive especially, because it could be HIV negative today and might be 3 months from now positive.
That's right. So they may
I
tell
understand.
you, I'm HIV negative,
You're absolutely
and they may
right.
be positive.
You're absolutely right. No
So
question.
you have to assume that they're positive.
I have already told you.
Right, so we
I have
agree on
already
that.
We agree on that. What we disagree on is the fact that I feel strongly a medical practitioner who is going to operate on an AIDS patient, draw blood from AIDS patients, do any kind of invasive procedure. And you know, the other side of this is what you should do with that HIV patient who's a medical practitioner. What
Let me ask you
what is
this.
the
Well, first,
American wait a minute, 1 minute. What is the American Orthopedic Association's view on what an HIV positive practitioner should say to his patient?
Doctor, first of all, the American Orthopedic Association, of which
Yeah.
you are clearly a representative.
I'm not a representative. I'm a
Well,
member of a society.
You're a member.
You're board
Of course,
certified.
I'm board certified.
Are
Let
you
me
a
ask
member
this,
of the
doctor. You
association?
brought with
Of
you.
course, I'm
certain-
board certified.
First,
Therefore, I'm a member.
All right, let's get a little control here. First, let me ask you this: do you feel that these universal precautions, as far as you're concerned, are effective and are protecting you?
To a degree.
Well, you're still
That's exactly
practicing.
my point.
You're still in medical practice.
All right.
So obviously you feel they're
As opposed to,
Well,
as
if you-
opposed to retiring?
Well, yeah.
Well, there are people who have, but I'm not one of them.
Okay, so you feel they're protecting you.
The American Orthopedic Society says the following. They state that if a physician, because you keep quoting the AMA, if a physician...
And every other group. Virtually every other.
About universal precautions.
Right.
And I agree with that.
And about not relying on medical history.
How about this position? If a physician knows that he's HIV positive,
well, are we shifting to the other side? I don't mind shifting.
This is a patient. This doctor is a patient.
Are we shifting?
Let me ask you this.
The doctor is a patient. I would like the answer to this because it's very key.
Go right ahead.
If a doctor is a patient, he is HIV positive. He or she is HIV positive. His position, according to our organizations, should be, number one, he declines to do invasive procedures. Our position, and the position of the organization to which I belong, not that I'm a representative of, is that this doctor should not perform invasive procedures.
Right. Your position, unlike most
and you don't think that's correct.
You want the answer?
No, it's not unlike most.
Well, you're
this
wrong.
is the position of this
But
major
what
group.
is your answer?
It is the position of this group, of which
Also,
you're a member.
also of the AMA.
All right,
No,
listen.
it is not.
Oh, yes.
It is absolutely not.
Oh, yes.
Doctor,
Should
let's
not
see
perform
if we can get
invasive
some
procedures.
information out
That
of
is
here.
Got the
absolutely
documentation
untrue.
in writing.
That is absolutely untrue.
Doctor, you brought with you certain items that you use to
Right.
protect yourself
Yeah.
from
I have an article
receiving
for you.
AIDS or HIV positive. Can you at least show the viewing audience what the items are
Yes.
and describe them to us, please?
This is one pair of sterile gloves. Universal precautions would dictate that we use a double pair of gloves. Does this prevent the needle stick? Absolutely not. Does this prevent a large shard of bone piercing this glove and causing a skin prick as well? No, it doesn't. There are also other gloves that are made of Kevlar and other materials that reduce the risk as well, but that intensely reduces the tactile sensation that a surgeon needs to perform surgery.
But I have one question. Let's assume that the law was different. Let's assume that the law was that the patient has to tell you his HIV/AIDS status beforehand.
Right.
What would you do then? We've already known is that you must practice on that particular patient. You must treat that patient.
Although
You
many
must do
doctors don't.
surgery on that patient. How would you act then?
I will explain to you the following. There are several ways in which things can be managed. There are frequently conservative methods of managing different problems and operative methods of managing different problems. If I know someone has advanced HIV disease, either has a limited lifespan or might be extremely high in terms of his viral content and infectivity, or stands a chance of an increased incidence of getting an infection postoperatively, and below a certain level of white count of the CD4 cell CD8 ratios, which is a technical jargon, but there are patients who are at very increased risk of having a very significant complication. If you don't know their HIV status or some other status, if I don't know someone is diabetic.
I understand, but what
would you
additional
do, is the
precautions would you take?
There are certain people who you would suggest, let us not do an operation
I
like
see.
this if you have a certain lifespan that's going to be diminished. We make the same,
I'm talking about
this same exact
But I'm talking about your risk,
decision
your
based
risk,
on,
doctor.
let's say, I'm just
this.
talking, my risk is different. What I'm suggesting is that there is a patient, let's say, has a fracture of one sort or another. If they have a 3-month expected lifespan, I might treat it differently.
Evan, let me ask this question.
Okay,
if I
but I
may.
would like to respond to that as
Okay,
well.
but please answer this question.
Okay.
I haven't read too much about AIDS. You know, at AIDS, regarding publicity, it goes up and then it goes down. You hear a lot about it, and then all of a sudden it goes to the back of the newspaper as opposed to the front page. What's the status now? Is AIDS in our area, is it on the rise? Is it diminishing?
No, HIV infection is continuing to rise throughout the country, not just in this area. In fact, it's in greatest increase in rural areas, in smaller cities, and certain other metropolitan
And
areas,
who are the-
for just the reason that the doctor's indicating, which is that people seem to think that somehow they can avoid this disease if they just shut their eyes, and that doesn't work.
Well, is it transferring? Is it transferring? I know originally it was in intravenous drug users and gay men. Is it transferring to other groups now?
Right. This virus is spreading through all kinds of groups. It is the fastest growing groups are women, for example, women whom people like other doctors might look at and think, well, she's a woman, she's not a gay man, so she's less likely to have HIV, so I can use this kind of precaution rather than that, which is exactly the problem, exactly the reason that the government says you've got to treat every patient the same, because you can't tell based on whether the person's gay or this or that or
But
that.
I'm trying to get now, if you're telling me it's on the increase, what kind of numbers are we talking about here in our area?
Well, I don't have the latest number in the area. I mean, there's certainly several thousands, tens of thousands of infected New Yorkers.
And well, what about as far as people who are walking around HIV positive who do not know they're HIV positive?
That's right. And in fact, the
majority... Are we talking hundreds, thousands?
Oh, we're talking hundreds of thousands,
Hundreds
possibly
of
over
thousands?
1 million Americans. And the answer, and the reason, the point, that's exactly the point. The point is, most people do not know that they are HIV infected. So if these doctors are going to rely on their saying, what is your HIV status? The person could in all honesty say, I don't have HIV, well, even though they do.
If you're in a risk group, is your recommendation to get a blood test?
The idea, first of all, there's no such thing as risk group. There's risk behavior.
Okay.
Okay? People who have engaged in certain kinds of behavior that made it more likely that they might be exposed to the virus,
and
even without knowing
it. What's your recommendation?
As to whether they should get a test?
That's correct.
If they feel that they will get access to medical care, counseling, treatment, and will not be discriminated against, will not be denied insurance, will not be turned away by doctors and healthcare professionals, for one's own personal health assessment, it's probably a good idea to know your status.
It's a very good idea to know your status, and the reason for that is that there are drugs and different treatment protocols, nutritional protocols, that increase lifespan and increase quality of life.
Well, the drug
if you can afford to get
the drug of choice now.
I agree with what you're saying.
Yes, but I think that's another issue.
Is that drug working? What's the drug of choice now?
Well, there is no drug of
Well,
choice. The fact is, they're very...
AZT is known by different initials now, and there's also 2 other drugs that are currently being treated.
Is it
currently being used, that is. Very effective in reducing symptoms and increasing lifestyle for a period of time. Yes, but again, it's lifestyle.
Well, we're not disagreeing, but there is no good drug out there.
Question. If a person is HIV positive, does that mean they're going to get AIDS?
In all likelihood, they're going to get AIDS. Now, let me just...
Well, Evan gave the figure of 1 million people in the United States, or over 1 million, who are HIV positive. Does that mean in 10 years or 15 years, all these people will have AIDS eventually?
Yeah, most of them. Probably all of them, but you can't say all.
Is AIDS always fatal?
Yes, just about always fatal. Again, within certain limitations. But let me just make a point, and I think Mr. Wolfson's point was well taken. One point that I agree on that he made was that it's risk behavior. Now, I disagree with Mr. Wolfson saying there are no high-risk groups, because there are absolutely very high-risk groups, but those high-risk groups are like that because of their behavior. And I think that, can you agree with that statement?
I mean, I don't want to quibble over words.
It's the behavior.
The problem with saying behavior is then people think that bad people who do bad behavior get...
All right, I'm not saying let me ask you this, Evan.
And we agree, that's not what we're talking about.
That's not what I'm saying.
How long, in your experience, how long does a person stay HIV positive until they get AIDS?
The doctor, we don't actually know the full answer to that. People can live for 10 years. The longest already we have 12 years.
Go ahead.
I can answer that for you. But
quickly.
The answer to the statement is that they could be infected and not have AIDS for 10 to 15 years.
Exactly.
How long does it take to become HIV positive after you receive an injection or something, or blood from an HIV person?
Well, it'll take usually 6 weeks to turn positive, but it can take up to years, but mostly between 6 weeks and 6 months.
Dr. Jeffrey Kaplan, thank you very much for being on Lawline. Certainly it was a very provocative show. And Evan Wilson from Lambda Legal Defense and Education Fund, thank you for being on Lawline. Certainly made it very interesting for us. And as always, this is Alan Schnorman, who's a little exhausted. And thank you for watching Lawline.
You have been watching Lawline with your host, New York trial attorney Alan Schnorman. Mr. Schnorman will be back with you next week at the same time. If you have any questions about this week's program, please write to Lawline, 63 Wall Street, New York, New York, 10005, or call area code 212-432-9111. This program is made possible by the New York law firm of Zollman and Schnorman, who specialize in the field of personal injury law, located at 63 Wall Street in New York City.